You're welcome, Doctor. Thank you for joining us.
Good afternoon. Good afternoon, viewers at home. Good afternoon, everyone in the studio and people out there. And I also bring greetings from the Chief Medical Director, Union Teaching Hospital, Oshobo. Thank you for having me.
Thank you for joining us today. Now let's talk about digital health or telemedicine. What is digital health? What's telemedicine?
Digital health is actually a broad term that involves the use of what we call ICT, information, communication, and technology
Okay.
to actually provide healthcare services for patients out there. So one of the components of the digital healthcare now is what we now know as the telemedicine.
Oh.
Yeah, so telemedicine is now the remote delivery of healthcare services to our patients. So that means it makes it possible for a doctor and a patient to be in different geographical locations, and at the same time, you can actually consult with your patient, irrespective of the geographical location differences. So that is what telemedicine is just about, breaking the barrier of distance and making it easier for you to communicate with your client. That's what telemedicine is actually doing.
All right. So that means that a doctor can actually attend to a patient that is not in the same geographical space.
Yeah.
That's what telemedicine is.
Exactly,
And
exactly.
digital health is different.
Digital health is more encompassing. That
Okay.
now involves the use of other mobile apps,
Okay.
electronic medical
Mm,
records, AI,
okay.
other things that the maybe tools or medical equipment could also do. That's digital health entirely. But
Okay.
telemedicine is now coning down to the use of technology to give remote healthcare delivery to your
To
client, irrespective of where the
person
patient
is.
is.
All right. This particular breakthrough in science, that's what I'll call it, that happened with a doctor in Florida, Vipul Patel. I think Vipul Patel, that's his name. He performed a remote surgery on someone that was in Angola, I think, particular doctor. What would you categorize? I mean, that particular surgery happened, while the doctor was in Florida and the patient was in Angola, although he had a medical team, on ground.
Yeah.
Under what would you categorize this particular breakthrough in science? And is this the future of medicine that we are
Yeah,
seeing?
that's where we talk about the digital health, because even
Mm.
robots now are being
Yes,
used,
he
yeah,
actually
to
used
perform,
the robot.
to
Yeah.
perform procedures. So it would be at the other ended monitoring what is actually being done
Mm.
at the other end there. So
Mm.
it makes it very easier. Then you can pass information across even to the team over there
Mm.
and watch what is being done. So that is all
All right, this
what's
particular thing about having patients record, your information, talking to a robot or an unseen person, how safe is that? I mean, we're talking about hacks, breaches, all of those things. How safe is it?
all right. Thank you very much. I'm going to come that down to what we actually do here at Union Teaching Hospital, where we use the electronic medical record to
Okay.
actually make consultations for our patient right now. You know, we are in a world where cyber hacking,
Yes.
cyber, what would you call it now? Maybe frauds. So it is not just limited to the monetary aspect or the financial world alone. So you
Mm.
can have hackers even in information in the health sector.
Right.
So to actually avoid or protect data or information which patient has provided, which is supposed to be confidential.
Mm-hmm.
Yeah. So to avoid the breach of such information,
Mm.
like we do, the EMR that we have, the electronic medical record that we have in UTH now, the first step is we have what we know as the user authentication you have your username, your password, which you use like as an authorized personnel to access the
Yeah.
system.
Okay.
Without that, you cannot access the
Okay.
system. That is for your own end there. And also, beyond that, we also have the Amazon Web Service that also provides security to guard data on the system too. And also, we have other systems too like the other software systems that helps to protect cloud computing information
Okay.
that are known globally to help in securing such information that we utilize. And like you said, there are different interfaces, because when you get to the hospital, there's somebody that would make sure maybe the record, you want to bring in your
Right.
social, the bio data. So such person cannot have information, cannot have access to your information, what you and your doctor is actually discussing.
Okay.
So we have different interfaces that you,
Okay.
as a non healthcare provider, will not be able to access. So all these things put together helps to secure the information of the system to a very large extent.
All right. So that's on your end. From your end, you people have that's Union Teaching Hospital
Yeah.
has a very good at least the barest minimum. All right.
Yes.
Let's talk about all of this health information that we get outside there on the internet. Several people, several content creators are coming up with different health-based content. They dish out advice, they give out medical, routines and all of that. How would you say that the association, your association now and Union Show from your end is what are you doing, to more like curb misinformation and then to stop, all of this false information and misinformation going out?
Yeah, thank you very much. The question you put out is a very, very important one, because sincerely, misinformation has misled a lot of people and actually sent to some people to their early grave.
Mm.
Mm? Like we are doing now,
Yeah.
it's part of what Universal Teaching Hospital does.
Okay.
Sensitizing the community out there, giving the correct information. Like aside this platform,
Right.
we also have what we call the Universal Half Hour, that the different doctors come on board to actually give the right information, because um I'll be able to speak of Universal Teaching Hospital,
Mm.
you understand, and in our own local environment, because at least a ripple would
Yeah, ripple effect at the
a
end of
ripple
it.
effect. So we bring out information to give the correct to at least to a very large extent, to help people know that no, this is not right, this is the right thing to do.
Right.
When you have chronic conditions, visit your doctor. Don't sit at the corner of your house, just look on the internet. I usually make pass information that if it's very easy to actually just get a symptom and make a diagnosis out of it and make treatment, I don't think a lot of people will actually go through the rigor of going to medical school.
Mm.
So you should not just sit down there, get on your system, because a lot of people have access to phone now and to data. So, and sincerely, they're not restricted. They just get there, put on their phone and roll out information where nobody is actually vetting. Is this right or is it wrong? So for UTH, I think you should commend us, because we have a lot of programs out there. In fact, for different days, maybe a WHO day, a cancer day, breast awareness day, we make sure that we come out there, use those opportunity to reel out information for people. And also when we find maybe one or two people that have been culprit of all this wrong information,
Yeah.
we as an advocate would actually seek to visit such centers and give them the right information, so that we be able to curb such occurrence in the nearest future.
All right.
Yeah.
I want to. I'm also guilty of something like that. Where we all have this impulse to go check the internet for something. Whenever we have, a medical issue, we just go and check. There is this there are this I don't know how to put it. Maybe terms in medicine, um, cardiomyopathy and cardiomegaly. They almost look similar. Even at the hospital, I had this issue where the doctor said some medical personnel came and they said this was a case of cardiomegaly, and another the head doctor came and then said, no, it is not cardiomegaly, it is cardiomyopathy. Now, the point is, in a case where this particular patient does not make it to the hospital, and the person just says, oh, I saw cardiomyopathy and most of my symptoms are seeming like cardiomyopathy. Or this person is thinking, oh, most of my symptoms are seeming like cardiomegaly. How do people then, what would you tell a patient, in that situation? And then, okay, let's talk about this. What would you tell a patient
All
in
right,
that
thank you very
situation?
much for that scenario you just painted. Um, I would give, even not going to something as big as
Big as that,
cardiomyopathy, as
yeah.
cardiomegaly, we have a lot of disease conditions
Mm,
that have same or similar symptoms.
mm,
You understand? That when you just read, sincerely, you might be confused
yeah.
and you might not be too sure. The doctor is going to put one or two together, coupled with some investigations that will be done sometimes to actually confirm diagnosis.
Mm,
It is not just about the symptoms alone.
mm.
So you cannot just sit down in the confines of your home and think just one or two symptoms is going to help you to
Affirm.
actually make or confirm diagnosis.
Mm,
So you need to actually go out there to see a doctor who has been trained. You know,
yeah.
there are specialists trained in different fields. That's their own specialty. And once they see one or two things, sometimes you do some investigation, they tell you, you need to do one or two things
Right.
furthermore to make affirmation to confirm this diagnosis.
Mm,
Even despite the fact that you feel you have the symptom or not. We've seen a lot of people that have misdiagnosed themselves
mm,
and mismanaged themselves from this.
right.
So please, we're using this moment to actually put it out to people that let's get to a specialist
Mm,
to confirm what we're actually feeling so that we are not going to mismanage
right.
ourselves. And at the end of the day, it's going to be detrimental to our health.
All right. Before we go on this break now, I wanted to talk about this practice right here where we do not have patients given access to their own medical file or medical history. Like, let's say that you're going on a transfer or something, or you just want to peruse to see how far, what your file holds about your medical history. Why is it like that? Why is it restricted in Nigeria? Or is that the practice world over?
Um, well, let me speak about our environment here.
Okay.
Medical information actually is not supposed to be restricted, although it is confidential.
Yeah.
But there are sometimes, like the EMR that I'm talking about now,
Mm.
the one we're using here at University Teaching Hospital does not allow access for the patient. There are there are some other ones out there, e-clinic, that has the patient portal.
Okay.
Yes, that the patient can actually access, could see maybe the diagnosis or management so far, could actually view the investigations done, could even book appointments.
Mm.
Yeah, as to that extent,
Okay.
you understand. But you have to some information. It's not as if it's not about mismanagement or maybe the doctor is not competent enough.
Okay.
But the way a patient is going
Mm.
to understand
Right.
or digest an information might not be the same thing with when the doctor is trying to actually explain to you
Mm.
that this is actually what's going. If you actually need a medical report, I don't think anybody is going to refuse giving one out. That okay, oh, what are you being managed for? You want to
Okay.
move to another town? You're traveling out, or you want to go and continue your medical care somewhere else? You are entitled to that medical information.
Okay.
Yes, nobody should actually restrict you from having that. However, in this environment, you cannot just go to the hospital and say, give me my folder or something. You
Okay.
want to tell them, okay, I need a medical report. I might need to do this. I need it. Maybe some people request for it in the embassy. Some when people
Right.
travel out. Sincerely, you have right to it and it should be issued,
Right.
irrespective of where you are assessing.
All right. You said something in passing about picking an appointment online to see the doctor and all of
Yeah.
that. Is that a common practice right now in Union Teaching Hospital?
No, not, I said not in University Teaching Hospital, but we
Okay.
have some medical centers that have been doing that in the
All right.
country.
So let's talk about that. That seems to be, it would be easy. It would grant ease of access to doctors, and it will even ease doctors as well. Why has Union not adopted that?
Um, we are just coming up as in concerning telemedicine
Okay.
or concerning digital health. You know, Rome was not built in a day, and we will eventually get there.
Okay.
You know, so there are other maybe some other bureaucracies or some other issues that need to be sorted. You know,
Okay.
especially things relating to government owned institutions. So you can't compare that to maybe a small area where a private owned institution is. You can actually make decisions very fast and on your own.
Okay.
So that's just it.
All right. There, viewer, I hope that you've been following the discussion so far. It's going to be more robust when we get back from this break. We'll be taking this quick break now. Stay with us.
There's no other animal as courageous and majestic as the lion. But with only 50 lions left in Nigeria, they may soon just be a memory. When snares are used for bushmeat, we rob the lions of their food and risk maiming them for life. So please say no to illegal bushmeat and help protect the lions. Keep them wild and keep us safe.
Some people say animals don't laugh, but perhaps we don't give them a reason to. Our unique species of gorilla are only found in a small forest between Nigeria and Cameroon. With only 300 left in the wild, we cannot afford to lose even one. Traps and snares used in catching bushmeat often kills or injures gorillas too, driving them to extinction. And that, you agree, is no laughing matter. So say no to illegal bushmeat from endangered animals. Keep them wild and keep us safe.
Welcome back to Spring Clinic on Western Spring Television. We've been talking about digital health and all that it entails. Now let's move to wearable devices where we have wristbands, right? The chest straps, the watches, wearable smart devices, from counting your steps to monitoring heart rates. They're everywhere now, really, doctor, um, especially in sports. But how viable, are these devices? Or are they just fancy? Do they actually give accurate information? Are they efficient?
Oh, thank you very much. There are different gadgets out there, which I also agree with you. And like you said, you know, we talk about standardization of equipment. How are you sure that this is actually still doing what it was meant to do?
Right.
We shouldn't forget that all these gadgets are built on the fundamental principle of engineering and physics. Yeah. And, they have different components built in within them, which also has their own finite lifespan, which could also be degradable over time. And also there is the terms of tear and wear and tear. So these factors really, in fact, even environmental factors like dust, our body fluids, exposure to chemicals, even extreme temperatures. There's some devices that are meant to work optimally under some particular temperature. When you're not bringing it down to a temperature region like ours, how do you expect, or how are you sure that you're still having the right information on what you are using? So, and that is why, sincerely, in as much as we also advocate for this, as clients or patients, you shouldn't extremely rely on it. We've seen people that uses even all you said, all these gadgets, the common ones that are even more common, more common. More common. The BP monitors, the monitoring, glucose monitoring devices. smartwatches to calculate
Yeah.
steps, check pulse
Right.
rate, you understand, that people use.
Okay.
And we've seen people rely checking their
So
BP,
much.
and they feel, I checked my BP, and the BP, when I checked that one today, when they come to the clinic, it wasn't, I've been checking it and it wasn't as high. Or somebody that was brought in an emergency,
Right.
and felt that what he has been checking all this while has been okay.
Okay.
You understand? So there is a thin line between, like any other system or any other equipment could malfunction. It could also happen to all these our or electronic medical gadgets. So we
Yes.
need to look out for them, be sure they are still doing what they are meant, or what the producers have produced them for or to do. As we use them over time, let's be sure that we fall back to the hospital to be sure that these things are still reliable before it actually puts us into emergency conditions or issues that we might find ourselves.
All right. Digital health that people have been talking about. It sounds ambiguous to people in this part of the world. Like it's something that would take years for us to start practicing. Just like you said, hospitals need, especially government-owned hospitals, need a lot of logistics. They need a lot of planning and all of that to put architecture in place to have that practice. People, do you think that, as somebody in that line and as a Nigerian, do you think that Nigeria actually, in the nearest future, at least now to very near future, do we have hope of having something like this sustainable in Nigeria?
Definitely.
Okay.
I think we do have, because with the advent of AI,
Yeah.
computer system, even the young ones now are more viable when they handle your devices at home. They can maneuver themselves, they can do one or two things. So you see that the future is actually promising for digital health. We are actually moving from where we used to be. Sincerely, we are not where you used to be, and it can only get better. Even simple social media platforms, WhatsApp, could be used for video calls. Part of the telemedicine is using video consultation. Yeah, clients could actually send you, I'm feeling, you can snap, you can do video and forward it to your physician. And even prescription, when you want to upgrade your prescriptions, okay, I got this prescription, or you went to the pharmacy, you got one or two things you want to clarify. You don't need to bother yourself going through the rigor of getting back to the hospital. The waiting time is also there for you to now start queuing again like you're a new client. You understand? So these are things that the telemedicine has helped us to overcome the barriers, and even taking time off work. I've seen some of the workers that want to come down and they'll be like, I need to attend, I need one I have to do one program or the other, and before they get to the hospital, time is gone. But when we can have all this, we overcome the barriers of time, of even cost. It's more cost effective, I think, in quotes, because when you look at other things that in the long run, you see that it's more cost effective. So as it has its own advantages anyway, it also has its own
Now we're going to get to
challenges.
that. I wanted to ask you this before we move to that. People would say that us patients, we've moved, we've left the medical association behind. We are already using gadgets like this and all of that. But what is, the field of medicine in Nigeria? Talking about the professionals, what are they doing? Like, how soon are we going to be seeing records being kept? Like you said, it's not all hospitals. There are some that will still go in search of their files, medical files, it delays and all of that. How quick would we be seeing, an improvement on that end? When will not a patient, a sick person or someone who has brought a sick person that is also stressed will not have to go through the rigors of that before, being attended to?
Well, like I've said, things will definitely get better. But the issue that might also cause some delay now is the issue of brain drain.
Okay.
Like we are talking about telemedicine, it is also somebody that will be behind the scene there. It is not as if it's just the apparat or the device that is actually consulting. So where you have shortage of manpower, at the end of the day, it might still cause some delay, even when we're talking about telemedicine. You understand? So, but like we are moving, we are not where we used to be. Even at UTH right now, you know, the issue of files is we are taking it from one department to another. You know, so we keep improving. You know, people change sometimes, and the issue with what do we call it, network services, sometimes you might have glitches, you might have all these, even with the telemedicine, that a patient is around and the network is not coming forth, you still have to wait, you still have to, you know, all those things. But sincerely, we will get there. We will get there.
All right. So we've been talking about digital health, talked about a part of it, telemedicine and all of that. Are there downsides to it?
Yeah. The main challenge that I would say, like I've mentioned not long ago, is the issue of network and technology. It is not everyone, like our parents now or our elderly ones, that are not vast with the use of devices, you understand? So it might be difficult for them, especially those or maybe rural areas that are not, even the network, some have to climb the mountain. I'm talking particularly about our environment now. So even get network to call their loved ones, let alone now communicating online, you understand? So these are part of the challenges we have here. Then also the issue of there are some conditions that sincerely you need to examine your patient. You need to just see that patient and be sure, irrespective of what the patient have said or video. We call something palpation. You want to actually inspect. You want to see. Okay, somebody is telling you for example, somebody is having an abdominal swelling. You want to be sure. There are a lot of organs in the tummy. It could be an issue with the liver. Is it the spleen? Is it with the intestine? Is it the kidneys? You know, somebody just saying I have abdominal swelling. So it is when the patient now comes around that you can say, oh, it is this organ. Oh, this one is actually looking craggy. You know, all those stuff which cannot be done online. So that is part of the drawbacks of telemedicine. And also, like I was saying, the issue with remuneration is also there. You know, if it is not standardized, it could be over or under. It could be a challenge for the provider who feels, how do I charge this one? And some people will feel, what have you done? You just typed, and you are using your intellect to actually provide that medical solution for the client. So that's another challenge, when people feel maybe when the client comes and sit down, at least I'll be able to make my bill, irrespective of making it very easy when you just put a chat across to the client and feels like, what has it done?
Right.
So those are part of the challenges.
All right. So now let's talk about how well, you know, digital health is going, what it's going to do. That's the advantages now, how effective is going to be handled, you know, as it's coming down here.
Like I've also said, part of the advantages is removing the barrier of moving around, you know, taking time off work, having to go and stay in the hospital for long hours, waiting periods. Those are part of the advantages that it has. And also, you could, for chronic illnesses that need repeated consultation, like somebody that is hypertensive now needs to be coming to the clinic regular. It's a non-stop management. So you need that to actually keep monitoring the patient. The patient might come in between, but at least you don't just leave the patient. Like diabetes, most chronic illnesses has a lot of benefit with telemedicine, because your monitoring would be at least up to date. It's not as if you just give patients appointment and in between you lose the patient to follow up. So that's actually very also important. So in maybe our own local environment here, Oshogo, we might not understand maybe go slows and hold ups. For highly congested area, maybe like Lagos State, they would actually appreciate it better when before you leave the highland from mainland, you use hours for move, you know. So these are parts of the barriers that it could actually.
In a nutshell, with that scenario you painted, digital health might really not be for everyone. At the end of the day, it might really not be for everyone.
At a time or another, you benefit from it. Yes. Somebody that is even digital health would also benefit from face-to-face consultation. So it depends on what the situation is. So I wouldn't say digital health is not for everyone. It depends on what the situation is.
All right.
Yeah.
Now let's talk about cost. You said it earlier that in the long run, it might be cost effective, but will it truly be cost effective? Now look at the breakthrough I talked about, the doctor in Florida and the patients in Angola. Yes, we might say that travel costs, expenses on the part of the patient has been taken away. But what about the team that went down to Angola to be there? What about the cost of the whole robotic gadgets and all of that? So will it really be cost effective?
Obviously it will. You know, there's a difference when you are offered something at the comfort of your home. For example, now if you want to order for food now, you could actually go down to the eatery. It's possible for you to do that.
Right.
And if you have the money, you feel it will be more cost effective for me to order, for them to bring it to me at the comfort of my home. Same thing with health. Even if the man that had the surgery did not have it at that other end, there is still also a team. A surgery is always with a team, which it will still pay for. But everybody likes being in the comfort of your home or comfort of your own environment to have services delivered to you. And that is where the cost effectiveness comes from. Because it is not about maybe the money in, yeah, but at the end of the day, it is more cost effective.
All right. Will everybody, because the medicine we practice now, you know, not everybody can afford it. People are still looking for subsidized, you know, medications and all of that. How is this going to be? Are we saying something that is going to be, you know, subsidized? Are we saying something that is going to be, you know, for everyone's benefit and all of that?
All right. Thank you very much. That will bring me to what we call insurance. Yeah. Some years back, we did not have insurance services like we have now. We talk about the NHIA, and particularly about the state, we have the Ocean Health Insurance, which is quite flourishing. And some years back, we did not have that. So as we also move forward in this digital health, I am sure the insurance would also come into it. And in one way or the other, you know, these health services, it is not as if it is subsidized, but you know how insurance work. You are using a pool of fund to take care of a particular people at a particular time, so you can move around. So definitely this would also cover for it, and that is what is being done in senior climes out there. You know, they have their NHS that once you are that you are legally you can actually access or
medical care.
They take care of it. So we are also getting there. So once we know that this is where our health system is now, the insurance also goes with us.
And because, you know, I was about to say that even now, it doesn't cover every aspect.
Of course. But it's more and more better now. Yeah, it has reduced the burden of health care funds for a lot of people. It has. Even people not even in the what do we call it now? The formal sector. People in the informal sector, vulnerable set of people that have been incorporated into insurance scheme. So we definitely, you know, as an advocate to the government, we also put it out there that we need for this. And, you know, we have people at the helms of affairs that have listening ears. So we definitely get there.
All right, let's talk about some myths around digital health. Are there myths that you've heard, you know, that patients will come to the hospital and say, oh, like they just come and they expect that this is what this entailed, and you have to enlighten them, you know, about it? Are there myths? Are there misconceptions, you know, about digital health or people's health, you know, generally?
I'd rather go with misconception.
Yeah,
not actually myth, because, you know, digital health is what it has been on for a long time, but in our environment is just upcoming. Yeah. So this issue of internet is actually because most people would have browsed,
right?
Have some background information before coming to the clinic. So sometimes you might need to actually now sit down, assess what how far, what information has this client in front of you known that you need to clarify, the ones that you need to actually put more energy to the, okay, this one is in the right way, or
yeah.
this is in the wrong part, or oh, this one you can actually look away from it. It doesn't, like, for example, now a child that is doing hiccups, that somebody puts wool, these are part of the things that have been
Those
done.
are the myths
Although is a myth, it doesn't injure the baby. At the same
Right.
time, you just said, oh, this baby might be dehydrated, you need to give more breast milk, you need to, so you address those issues. And that is why it's important for you to first seek what information, how far, or what depth of information that the client already knows that you might need to actually clarify and address some misconceptions.
All right. So generally, as we begin to, custom, what if you were to, talk to people, patients, or you were, as it is now, using this platform to talk to, people out there, what would be the things you tell them, those who are expectant and expecting better results in terms of digital health, those who have gone way too deep and have gone really, really, in the wrong path, being misinformed and all of that. What would you tell, and how would you say that, expectations should not be, that, far, and how would you say that they should live within the spheres of medical, medical terrain that we have right now in Nigeria?
Yeah, thank you very much. Information is ongoing. You cannot know it all. And that is why we will tell our people to always seek information.
Right.
Medicine is evolving. What it was a decade ago is not what it is now. So that is why we know we have what we call, even for healthcare providers, we have what we call continued health or medical education. Because you can't say, well, what you've learned over 10 or over a decade or 2 decades ago is what is still practicing now. Researches are ongoing. So what I would tell our people out there is they should ensure to seek healthcare provider from certified healthcare personnel. And even it is not only to our people out there alone, even to people like you that anchor programs, please, when we call, like you've partnership with the CMD and UTH now, let's know people that will call in for programs, because once people have a trust in the brand, or maybe in the like the radio or the TV station, the information they hear, they tend not to actually try to sieve or to vet it. They take it in line, hook, line, and sinker. So I think also you have some duty at your end, like we also have, and viewers out there, to make sure that you seek help from certified healthcare personnel at accredited healthcare centers. There are different healthcare centers out there, a lot are out there. So let's be sure of where we are going to, and when we are at crossroad or we are not sure of what is going wrong with you, please ensure you actually make sure you get correct and adequate information. Don't make it a routine thing like that's how it should be. No. Sometimes it is not always what you feel it is. So it is good to actually clarify issues. Thank you very much.
All right. Would you say that all doctors, all medical personnel are versed, in the line of digital health? Or would you say also that probably as, things are unfolding, they would need trainings and retrainings? And what are steps that, your medical association is taking towards that?
Like I just mentioned the CME now, that is part of the things we'll do. So once you observe there is a new groundbreaking thing that we need to know, it's a continuous thing. You learn until you enter the grave, sincerely, or else you are left behind. So the medical association ensures that we have this every year, year in, year out. No matter how long you've been in the profession, you continue learning. So this will actually bring more information to you. Then you'll be more vast in all we are saying. The digital health, there are different platforms out there that offer this digital health. So that is where you actually familiarize yourself with all this, and you'll be able to put yourself to use so that you are not left behind in the analog generation.
Right. All right. Thank you so much for, your time on digital health and all of that. It has been a very enlightening time with you, Doctor. Thank you very much for, enlightening us, for, reducing the misconceptions, right here and all of that. We appreciate that. All right, digital health, as you heard today, is reshaping medicine, shaping telehealth, health, wearable devices, right? Digitized records, data-driven insights, even personalized medicine. And it promises improved access, efficiency, and patient empowerment. But the challenges remain, data privacy, unequal access, integration with existing systems, and just like Doctor said, talked about telecommunications not being stable around here and all of that. That's internet access. Sometimes it's shaky and it's wavering, and the constant need for evidence-based solutions. So today, you're asking, I'm asking, how ready are we to trust the future of medicine to our phones, to our screens, to our devices? Those are the questions. Doctor has answered some, but we'll always have more. This has been Spring Clinic. Thank you for joining us. Thank you for keeping faith. And until next time, stay informed with the right information, though. Stay safe. And most importantly, stay healthy. I am Timitope Ajijolaoluwala. See you again.